Today we're going to talk about the benefit of being circumcised prior to your penile girth enlargement treatments. I tell patients, they ask me, do I have to be circumcised? I say, no, you don't, okay? But statistically, let's say we do a penile shaft and glans enlargement, right? Let's say here's your glans and shaft. We fill the shaft, right? Let's say you're not circumcised. There's a certain portion just under the glans, right over here on the shaft, that the skin is so thin and fragile that we cannot put filler. Okay, so what happens is as you form collagen, increase your girth, you'll notice that it's thick here and then it thins down at the top, right? Now, 40% of my patients say, hey, I don't care. Looks fine to me, functions fine. But 60% say, hey, I want this balance, this section over here. They want that thicker to match what's below, okay? So let's say, for example, you don't want to get circumcised, but you know that if you were to increase your girth in the shaft and you know ahead of time this is going to be thinner, you have the option afterwards to do a circumcision, okay? So the benefit of being circumcised is you don't have that fragile, thin skin in this area, okay, which allows us now to bring the filler all the way up as much as possible up until the base of the glans, okay? And that's your advantage. So you make a decision. If, for example, you're not circumcised, you can opt to do the procedure, knowing that you may need to circumcise after the fact, depending on how it looks. And if you choose to do a circumcision first, we have a procedure where we do the circumcision, and at the same time, we can do some filler supplement here, right? So we can get you started on your girth treatment. So, for example, you come in, you do your circumcision, we do a girth filler treatment, we call it a girth supplement, and then after that heals, then we fill the entire thing again with some extra here, because remember, we can't put filler where the stitches are, but on a subsequent treatment, we could put extra here to match, because we want everything balanced. And of course, on your second treatment, you do the glans. First treatment, circumcision, shaft supplement, we can't really do the glans because when you cut the skin here, we're kind of compromising the circulation already, so I don't want to stress the glans. So that's why we do not do a glans treatment when we do a circumcision combination shaft supplement filler, okay? So if you're thinking about doing the procedure, either way is fine with me. It's not mandatory to be circumcised, but you have to be aware if there is an imbalance, you'll have to come in and have that corrected with a circumcision.